The unit is a two-storey block, or a pod, set out above the ground. It's set out on 16 7-metre-high support columns. The occupied floors are wrapped around existing structures. Drainage and service runs forced the decision to lift it off the ground. Some existing old stock had to be knocked down to clear the way for the new build, not least a quintessentially awful wooden fire escape corridor. It provided a clear space, but has still been a tight fit, and not the nicest of surroundings. Wrapped in bright blue powder-coated aluminium mesh cladding, the new building stands out from its surroundings. But by raising it off the ground, it offers the benefit of elevated views over the grey roofs of the hospital precinct, and it's given the building a new name. It is now officially known as the Skypad. As with the Maggie's centres, the intention has been to de-institutionalise this particularly sensitive sector of health. It's been done here through the collaborative approach and also through design solutions. The key agenda was to normalise the experience of cancer treatment for the youngsters as well as for their family and friends. The architects even suggesting that they were trying to create the feel of a boutique hotel.
Over the last 10, 15 years, there's been a complete change in the way that hotels provide an experience. From the moment you walk in the door and you are welcomed and you are greeted, and it's very seamless, and you feel as though you're being enveloped by them and welcomed by them. And it was that level of service which is not just about the patients and how they interact with the staff, but it's also how you're greeted when you arrive at the unit, and this sense of being, I've arrived somewhere that I'm going to be looked after, and thank goodness I'm here.
What we're trying to do is get a normal young person out at the end, really, make sure they keep their supportive networks, make sure that they can keep connected by the internet, by mobile to their friends, make sure they can be nursed with their friends so that they don't lose who they are, really. I think a lot of people say that cancer should be a comma, not a full stop, really, to these young people. And if they are institutionalised in what would be an institutional ward, however good your nursing staff are, you really haven't got those facilities that allow them to be normal, and at the end it's really difficult for them to pick up where they left off.
The building cost £3.4 million, including fees, fit-out and VAT.